So let's talk about human resources and payroll. In most facilities, HR and the payroll director, these are usually combined into one position. If a facility has more than 120 beds, the company might be able to afford to be able to have these positions split into two. However, most of our facilities, HR and payroll is one person. So in addition to the human resource functionality, and in addition to all of the payroll function and staff orientation, this person also has the responsibility of accounts payable. So all of the bills that come into the facility for groceries, medical supplies, for your office supplies, this HR payroll person usually handles the AP process as well. So with the HR aspects of the business, this includes all of the onboarding, all the hiring, all the recruitment of new employees, as well as when employees leave the facility, they would coordinate exit interviews. It's always a good idea to find out why employees are leaving, and most companies would have their HR and payroll person coordinate exit interviews upon a staff leaving their department. The HR and payroll person also maintains all of the personnel files, make sure they're organized and all of their records, all of their certifications are filed properly in their HR files, in their personnel files. This person also develops new employee orientation. It's a good idea to have new employee orientation scheduled at least once a month. Some facilities do it twice a month, say the first Tuesday or the first and third Tuesday. So any of your new employees would be set aside in a designated place like a classroom to go over all of the company and facility policies as a new employee. So this person has a very busy job, and they offer expertise and assistance as needed for any disciplinary actions and staff development that is needed throughout the facility. And again, we're talking about all of the employees in the facility. So this one, maybe two employee personnel department, usually it's one, sometimes it's two, but it's an enormous position. And it's one that we have to make sure as administrators that we are supporting them, making sure they have enough time to complete their work, that they have the privacy that they need to complete their work, to keep the files accurate, to help with all the onboarding and offboarding. This is a very critical position in the facility. So on the HR and payroll functionality, this person oversees the payroll functions. There are many payroll functions, and it's important that when you onboard as a new administrator that you spend time with this HR person to make sure that it is understood exactly what the payroll functionality is set aside by a corporate entity. There's also the payroll process and all systems that are in place for payroll. This person monitors overtime to make sure all the employees are clocking in and out on time. There should be a policy to make sure that staff should not clock in too early or that they should not clock out past their shift. If they do, that rolls into overtime, and any and all overtime must be pre-approved by their director, by their department manager, to make sure that overtime is not excessive. The HR person runs reports, tracks hours worked, enters time and adjustment of time. This person is monitoring to make sure, again, that staff's not working overtime and that payroll reports are accurate before payday. That's very, very important. Okay, looking at nursing administration, there are a variety of nursing admin positions for managers and even staff nurses. It's very important that you understand each of their roles and what their function is in the facility. So of course the chief in the nursing department is the director of nurses, oftentimes abbreviated as DON. The DON is an RN, which is a registered nurse. We've talked extensively about the relationship between the administrator and the DON and how critical their relationship is to the overall success of the facility. These two must work collaboratively to provide and to oversee the overall care provided in the facility. Second in command is the Assistant Director of Nursing, that's the ADON. There are usually unit managers who assist the ADON and the DON with additional responsibilities. They oversee clinical staff, scheduling, systems, and overall care that's being provided. The ADON and the unit managers work to oversee the clinical care along with the DON. It's very important that these positions as charge nurses, as unit managers, that they are making room rounds, that they are visiting residents and patients on a very regular basis throughout the day. They need to be very visible, making rounds to make sure that residents' needs are being met. They want to assist the CNAs on occasion with call lights. And in fact, when call lights are being, when residents ring their call light needing assistance, it is the responsibility of everyone in the facility. All employees should help. CNAs definitely have a big part in helping to answer call lights, but also unit managers and the nurses also. It's not uncommon, speaking of call lights, it's not uncommon for other staff who are walking down the hall, a housekeeper, a dietary manager, if someone's walking down the hall and a CNA or a resident rather turns on their call light, it's important that we all stop to answer to see what their needs are. Under nursing administration, there's also the director of staffing development. That person has a huge job to make sure that everyone's on schedule, that everyone's working their schedule, that staff are invited to participate in helping to plan their schedules. It's important that we remain flexible. The majority of our nurses and CNAs in our facilities are parents, usually they're moms. A lot of them are single moms, and they have children and responsibilities, and so we have to offer flexibility with their schedules. If they need time off to pick up their children at the end of the day, maybe they can do a flex shift. Or if they need to be off for the school play or holiday events, it's important that we work with the staff development director to help to ensure that the facility is well staffed. It's just important that we offer that type of flexibility. We also have the MDS coordinator or nurse, the minimum data set and assessments. This is the overall care that is documented for clinical care. This is what helps drive our revenue. So this MDS coordinator or nurse, it's a very key position within the nursing administration department. There's a case manager usually in the facility who might partner with our HMOs and our managed care organizations. They may have an indirect role in the facility, or companies might hire case managers as nursing staff within the nursing department. Some facilities do have a wound care nurse. That position is vital to make sure that our residents who might have skin breakdown or who have other skin problems, that their wounds are being treated. They oftentimes work collaboratively with therapy as well. Staffing coordinator is another position. Again, along with the staffing director of development, staffing coordinator is the one that helps to make sure everybody in the nursing department is working their shift and that they are also working on, we try to make sure we are providing continuity of care, and so having them work a certain shift in a certain floor on a consistent basis certainly helps with that on a day-to-day basis for our residents. So the nursing administration team usually consists of your DON, your staffing development director, wound nurse, case manager, MDS coordinator. Each of these positions together form a very strong nursing team, which is what our facilities need. Our nursing care positions in the facilities are very important. It's important for you to understand the difference between RNs and LVNs. RN is a registered nurse who has completed a 2 to 4 year program, who has completed the NCLEX RN exam. This registered nurse has skills above and beyond the LVN. LVN is a licensed vocational nurse, and in some areas you might also hear of this nurse being called an LPN, licensed practical nurse. One and the same. They have completed a 1 to 2 year program. Tarrant County College does offer programs for LVNs on our campus. The scope and practice for an LVN is much different than an RN. Again, a registered nurse has additional skills with skills of assessment and more practical skills for assessment and care for our residents. We have charge nurses / floor nurses. Charge nurse can be any of these nurses, LVN, RN, or the LPN, and their job is to oversee the clinical care that's being provided on their specific shifts on a day-to-day basis. Other common positions in the nursing department, of course, are the CNAs, who are the backbone of the long-term care facility. CNAs support residents with a wide variety of ADLs, their assisted activities of daily living, their dressing, brushing their teeth, combing their hair, getting dressed. Our CNAs also help out with other duties like light housekeeping. If they notice blankets are not folded, or if there's trash on the floor, if a resident needs help opening their mail, they are there to help provide assistance. They also provide assistance with just customer service needs, just being friendly and attentive to whatever the resident might need at that particular time when the CNA is around. Certified medication aides are those who would assist nurses by passing just medications. As you all have learned during your chronic disease presentations and your research papers, there's a wide variety of medications that are needed for the diseases and the processes of diseases that our residents live with. So CMAs, not every facility has certified medication aides, but some do, and they are always an asset within the nursing department. We have our restorative nursing aides. They work under the supervision of nursing, but the plan of the restorative program is directed by therapy. And so this restorative nursing aide works in collaboration with therapy, and again overseen by the nursing department, by your charge nurses, maybe by the ADON or the DON, and they are there to help residents achieve their functional status with maybe ambulation or other types of functional needs that the resident might have. If you have a restorative nursing aid program, that is such a benefit, because residents who need additional assistance really benefit from this program. So as you can see, there are several positions within our long-term care facilities that they're all very important. No one position and no one department is more important than the other. In our organizational management class in the spring, we're going to talk a little bit about how our departments, there's a lot of overlap with departments. I'm going to talk about ways in which the different positions function together, how they're similar, and then also how they differ. It's going to be really important for you in your future practice as an administrator to understand how the departments function, but more importantly, how each position functions and what their roles are. I hope this has been helpful.